Happening now, the Ontario Health Coalition has released a report on the harmful impacts of moving surgeries and exams out of public hospitals and into community clinics. Let's listen in live.
The government is treating the public nonprofit hospital system compared to how it's treating private for-profit companies that are moving in to take over. And what we found is that the Ford government is, without question, robbing from the public to build the private. And the contrast couldn't be more stark. I'll just summarize the key findings of the report. All across Ontario, there are operating rooms in our local public hospitals that are sitting unused, completely unused. Some of them converted to being storage closets, used as storage closets, or just completely shut down. They're functional, but they're not used because the hospital doesn't have the funding to run them. And funding is critical to being able to attract the staff and retain the staff. In other hospitals across Ontario, the operating rooms are closed the majority of the time, and that applies to every hospital in the province. And so I'll just run through. We did freedom of information requests, and we sought data from the surgical staff in hospitals in every region of Ontario. In these communities, the hospitals have operating rooms that could be functional, but are completely unused for days, weeks, or permanently. That's Alexandria, Brockville, Cambridge, Hawkesbury, Kitchener, London, North Bay, Oakville, Sault Ste. Marie, St. Catharines, Southampton, and Wyerton. In these communities, the majority of the operating rooms are closed the majority of the time. That means they close at 3 p.m. or 3:30 p.m. They're closed late afternoons, evenings, overnight, and on the weekends. That's Alliston, Almont, Barrie, Bowmanville, Carleton Place, Collingwood, Cornwall, Kingston, Meaford, Nepean, Niagara Falls, Orillia, Oshawa, Ottawa, Pembroke, Peterborough, Toronto, Welland, and we just got in Thunder Bay just before the press conference, and Thunder Bay also. So I say all of these names because I want to illustrate in kind of visceral terms. Everywhere in Ontario, communities have literally spent 100 years building those local hospitals, paying for them, funding them, trying to attract staff to them, subsidizing municipally benefits and things to bring in the staff to staff them. And they're sitting there idle. Well, the province is shifting literally hundreds of millions of dollars over to for-profit clinics, for-profit hospitals, and for-profit staffing agencies. In short, in sum, this is what the Ford government has done. This year, they're imposing real dollar cuts on the operating budgets of public hospitals. They are increasing at 0.5% only, which is far less than the rate of inflation. That means local public hospitals cannot even keep their existing services going, let alone be able to recruit and retain staff. Overall, health funding is also running at less than the rate of inflation. It's running at 1.5% increase. But when you look within the healthcare budget, there are some sectors that are getting enormous amounts of money, none higher than no one has received bigger increases than the for-profit clinics and hospitals. The Ford government has given a 212% increase to the for-profit clinics. It has given a 278.2% increase to a for-profit hospital. There are only 2 for-profit hospitals left in Ontario. So contrast that to 0.5% increase to public hospitals. They're funding the private for-profit hospitals at double the rate per surgery that they're funding the public hospitals. They're funding the private for-profit cataract surgery clinics at 21% higher than the for-profit hospitals to do the same surgeries. Or in fact, the surgeries done in the private hospitals and clinics are the lighter, easier, less costly surgeries. In one contract, and that's just the low end. In one contract that we did freedom of information requests for in Kingston, they found that they're paying 56% more to privatize the cataract surgeries there. They have refused to take action on the for-profit staffing agencies that are charging up to 3 times or more for staff than the public hospital staff would have been paid. They've escalated their prices more than 70% since the Ford government took office, and hospitals have increased the amount that they're paying to for-profit staffing agencies from $38 million to $168 million just in 2 years. That's a four times the amount that they paid 2 years ago. This is a vicious cycle in which local hospitals are funded at less than the rate of inflation, can't even keep up with inflation, let alone population growth and aging. And so they have to increase their reliance on for-profit staffing agencies, which the staff then choose their shifts in those agencies. They can choose only the day shifts or the preferred shifts and not do the evenings and overnights and weekends, which are not the preferred shifts. It is no surprise then that hospitals have a much harder time staffing the overnights and the evenings and the weekends, and we're seeing all kinds of hospital services closing down in the evenings and the weekends. In fact, in the last year, there were more than 1,200 vital hospital service closures across the Ontario. It's a robbing from the public system to fund and build a for-profit private system. The Ford government has chronically underspent the healthcare budget, shunting billions, literally, to contingency and budget surpluses rather than providing that money to local public hospitals. The bottom line, hundreds of millions of dollars in public money is being siphoned out of the public system, used to dismantle and privatize our public health system, privatizing our public hospitals, and enriching a few for-profit corporations, many of them with well connected to the government. And it's beyond time. This is our call to action. It's beyond time that there be a rigorous investigation into who is benefiting from these policy choices and what their connections are to this government, because the costs and threats to single-tier public Medicare in this province are very real and very urgent. And I've asked France Jelena, as you know, in order to use a media studio at Queen's Park, you have to have a political party sponsor it. So we're nonpartisan. I always have to say this, as you know, and we've provided this report to all of the political parties, all of the opposition parties, and also to the Premier and the Health Minister. And I asked France, who is sponsoring the use of the media studio, if she could give her reaction to the report that she received last night as well, and then we'll open it for questions.
All right. The Ontario Health Coalition releasing a report at Queen's Park on the harmful impacts of moving surgeries and exams out of public hospitals and into community clinics, accusing the Ford government of chronically underfunding and starving the public healthcare system. It is now calling for a rigorous investigation to look at the Ford government's handling of the healthcare file.